Hello, Namaste. I welcome you all to the 72nd session of GURUBODHA. I dedicate this and all of my works at the holy feet of Dr. Chandrasekhar Udupa. This class is live for Easy Ayurveda weekly class subscribers. If you have not subscribed, please go to easyayurveda.com/video-classes. So getting right into the session, let's go through this case. Female 35-year-old married with two children. Prakriti is Vata Kapha. Vikriti, let's find out as we go further. With history of teenagers in college, had a lot of sinus infection, which is usually due to Kapha and Vata dosha. And age 2024, appendicitis, had high fever and right side sharp pain. The hospital diagnosed with Crohn's disease on prednisolone, which is a prednisone. A low dose some chemotherapy pills were given. After a while, I realized that I had to stop the medicine. Nothing happened and I was fine. Main concern, body rashes since 2011. So a chronic case here. After first child born, newest symptoms started after first child born since 2011. Usually postpartum care of Ayurveda. That's why it is stressed a lot because immunity will be low and, many say low immunity opportunistic disorders or some autoimmune disorders, there are chances for that. That's why Ayurveda advocates for proper postpartum care. It's a branch in its own. Feel really bad and can't do anything, getting headaches, swollen, hurting, foggy feels like everything in my body is tiring. If I had to eat something, I would try new things. Every time I get rashes on skin. Headache or intestinal reaction and tends to last 2 weeks and dies down. Stress relation, skin gets more inflamed and headache and body fatigue reaction. Always had dry skin. Life is vata prone. No regular routine except dropping kids, running all the time. Home consulting, irregular eating timings, and current food intake, green leafy vegetable juices. This is again a topic on its own. So this is the condition.
See, one thing I think going to the history given here, one thing is clearly seen that it's a chronic case, number one, presented since 2011, and very importantly, after the first child born. So, as you rightly mentioned, pregnancy, during pregnancy or during the post-pregnancy care, during postpartum care, this problem has started. Probably it has worsened since then. So we also have a diagnosed condition there, like Crohn's disease is there. So we know that it also has an autoimmune component. So here the gut involvement can be seen, and going to the causes, sinus infections and other things can also be seen. We also have a long history of chemotherapy and also probably prednisolone consumption. Here we can see that after a while I realized I had to stop the medicine. So here is the problem. The doctors have not probably guided the patient to stop prednisolone or any chemotherapy pills, whatever were given, so pretty long time. So we know that what effects they can have over our system in the long run. So anyhow, it was needed for Crohn's disease. It was given, but later went to taper, went to stop, and that thing I think was not monitored. So very importantly, the what we can call it as the paschat karma. So the post-operative follow-up was not proper, either from the part of the patient or from the doctor or from both. Here the Chikitsa Chatushpada. So some confusion is there here. So later we can see some body rashes is the main concern. So that is the Pradhan Lakshana presenting complaint, body rashes, that we can see in the picture also. Quite lot. So if you can expand the second picture, Dr. Heber, second one there. And it's in like angry red color, still not able to appreciate the lesions. Can we go to the other picture towards its left? So typically presenting on the palm, and what was that part of the body? I think forearm or something.
The forearm, yes.
Forearm. Okay. From Ayurveda perspective, if we are looking at this case, we shall not bother about these things. One thing I can recollect is how we shall go ahead with this particular case. So if the patient were there, it would have been easy. What else was tried from 2011 to 2023, 12 years long history, different things the patient has tried on this particular condition, that would have been very clear for us. I can remember a condition called as, I may be wrong, palmar erythema. So there is a condition called as palmar erythema. So where there is redness of the hands, which is typically related to the pregnancy. So in modern medicine, we can find a condition called as palmar erythema, which is typically related to pregnancy, during pregnancy, and post-pregnancy. Some women have that palmar pregnancy, which may go off or which may continue longer, depends on. And it is also depicting many conditions, many interior conditions It is also called as the liver palm. So it has some relation with the liver disorders and many other chronic disorders. So the redness, many times, what I want to tell is the skin disease or something manifesting on the skin doesn't actually belong to the skin. Skin is not the culprit, skin is the victim in this particular case. It is a reflection of, like, skin is like a mirror image, a reflection of many things which is going on inside our when body, when there is beyond tolerance, the body cannot tolerate certain things, and it wants to tell something. There is a secret language of the interior of the body. When it wants to tell something, it definitely tells through the story of the interior is told through the skin. It is very important. Skin is, most of the times, it is the victim. It is showing the story of somebody else, something else which is happening. Maybe a liver disorder, maybe a stomach disorder, maybe a gut related disorder. So anything it may be, maybe an autoimmune condition. So in this particular condition, palmar erythema is a condition wherein it is depicting some interior problem like a liver problem or some other problem. Crohn's disease also was there. Some autoimmune component is there definitely in this particular condition. The lesions are also seen elsewhere also. Going through Ayurveda analysis of this particular condition, so we can another condition is lichen planus or lichen planus, we can call it as. So it has a similar presentation. It also has an autoimmune component, flaring redness, and also it appears on the skin and the mucous membrane, also in the mucosa of the mouth, etc. Again, if the patient were there, it would have been easy for us to know if other than the skin, if it is there also on the mucous membrane and other parts of the body. So only trying to differentially diagnose this condition by seeing the lesions presented and also the case presented here. So one, we have a sinus infection component, a Crohn's infection component, long-standing case history, and also a long case of a drug consumption and also prednisolone consumption. Something has meddled with the autoimmunity, and this particular problem has occurred in this particular patient. So going through the Ayurvedic perspective, we shall simply look at the redness there, and also some small eruptions of the papules may be there on the left picture. So going through these things, very simple, we can consider it as a Rakta predominant condition or a Pitta predominant condition. So, or we know that Pitta and Rakta, they are having Rakta and Pitta are having Ashraya Sambandha. So Rakta is giving Ashraya, it is an abode of Pitta. So mutually they are contaminating each other, or mutually they are supporting each other in healthy conditions and contaminating each other in the pathological condition. So let's dig little bit detail before going to the treatment. So because it is very clear that by the patient's narration of the problem, that the patient has tried a lot but still suffering from some feel really bad. So that is enough for us to know. The patient is feel really bad and can't do anything, a sense of helplessness, probably tried certain things after that. So probably we could have got a detailed history. Nonetheless, we will go here since it is chronic and it is also playing. So this headache, swollen, hurting, foggy, feels like anything, tired body, headache, intestinal reaction, all these things are definitely related to something great which is happening inside, maybe an intestinal problem or a liver problem, something happening. Along with the skin flare-ups, these symptoms are also coming up, or along with these symptoms, the skin is also flaring up. And once it comes, it tends to stay for 2 weeks and then it dies down. How it dies down, we don't know. Whether it dies down along with the other symptoms or whether the redness and the skin part itself dies down, we are not sure. But there is a relieving factor. Somewhere it tends to live for a certain period and it comes down with or without medication or whatever. So considering this, going through the Ayurveda, we can just consider this condition as Kusta, number 1, Vatarakta, number 2, a bridge. So we have a condition called as Uttana Vatarakta. We also know that the treatment of Kusta, wherein a big range of skin disorders have been explained, wrongly coined as leprosy. It is beyond leprosy. Kusta is having so many conditions, as many as 18 conditions, different conditions of skin, 7 types of Mahakusta and 11 types of Kshudra Kusta, and also Dhatugata Kusta, and so many types of variants have been explained by our Acharyas, and Vatarakta. So these two conditions are the treatment is interchangeable. So even in clinical practice, I have seen treatment of Kusta most often applies to Vatarakta. So what we diagnose as Kusta, many times it will be Vatarakta. And many times what we diagnose it as Vatarakta will be Kusta. Take for example a psoriatic arthritis. So here the arthritis appears even without the skin lesions. Many times it appears without the psoriatic lesions. It is diagnosed as psoriatic arthritis. But the psoriasis symptoms or the skin manifestations may come in the later period, but joint involvement is earlier in most of the conditions. Here, if we try Kusta Chikitsa, it will be helpful. Even if we try Vatarakta Chikitsa, it will be helpful. So, these conditions, the treatment the principles are interchangeable in Kusta and Vatarakta. So I would like to put this into, there is a condition in Vatarakta like Uttana Vatarakta, so, and Gambhira Vatarakta. Uttana Vatarakta is the superficial tissues like Tvak Rakta are involved, and in Gambhira Vatarakta, the deeper tissues are involved. So this palmar erythema and other redness and also other skin manifestations which are flared up red and manifest over the skin and not involving the deeper tissues will be considered as Uttana Vatarakta, and Gambhira Vatarakta will be a more deeper condition. So, and in this particular condition, we also see that apart from the redness, it is a reflection of something which is hidden inside the body. We can also consider this as Gambhira Vatarakta. There is Gambhira Vatarakta which is manifesting here. Okay, so that is the differential diagnosis. But mainly we will put this into the picture of Kusta and try to see the redness and try to address it in terms of either a Rakta aggravation or a Pitta aggravation or mutual aggravation. Even if we go to the Pitta Rakta Vruddhi Lakshana, we can see Visarpa, Pliha, Vidradi, Kusta, Vapasra, Pittasra, Kusta, Vapasra, okay, Visarpa, all type of skin manifestations are mentioned in the Rakta Vruddhi conditions. So where the blood is abnormally increased or pathologically increased in the system, that also can be considered. And if we consider this as a palmar erythema, some other condition, we can also take Rakta Dushti, Rakta Vruddhi, Kusta, Vatarakta. Okay, so and then Raktagata Kusta, we also can take it as Raktagata Kusta or as I said, Uttana or Gambhira type of Vatarakta, depending upon how much the interior has been damaged and all those conditions. Coming to the Kusta again, if we need to classify this, so it's very difficult to tell which Kusta. So according to the symptoms, it is looking like some types of Kusta mentioned in Mahakusta and Kshudra Kusta conditions. Mainly when we go to a condition called as Mandala Kusta. So I'm not telling the diagnosis, I'm just telling the differential diagnosis, how to look at this particular picture. Shvetam Raktam Stiram Stanam Snigdam Utsanna Mandalam. So it is like in the form of a mandala. It is in the form of a circular elevated lesion. Shvetam Raktam. It is a mixture of whiteness and redness. We can see the mixture of whiteness and redness interspaced. It is not totally pitch red there. So some spaces are there. Stiram Stanam Snigdam. So it is Snigda. It is not Ruksha. Though the patient said that the skin is often dry. Here we can see especially the palm is shining and it has a wet texture here. And Utsanna Mandalam, a Kruchram Anyonya Samyuktam. This patient should clear here. Kruchram, it is difficult, and Anyonya Samyuktam, small mandalas, small circular lesions will form. Gradually they will accumulate with each other. They will join each other to become a bigger lesion. So small lesions getting assembled and later joining each other and becoming a bigger lesion. So that is what we call it as Mandala Kusta, that falls under the category of Mahakusta. And some more things if we see, there is a condition called as Alasaka. Just now it has been compared often to lichen planus, this condition. Kandu Madbischa Saragaihi, Gandaihi, Alasakam Chitam. Kandu Madbischa Saragaihi. If the itching is there, I don't see the patient mentioning itching anywhere in the case history. We can rule out, but depending on this, Saraga, so there is redness, and Kandu, if it is there, it can be considered as Alasaka and treated accordingly. Again, the kapha predominant symptoms will be there. Yes, there is itching. Mona Bhatji, I think she has presented this case. She has mentioned, yes, there is itching. So this can also fall under the category. See, Ayurveda explanation, they have not mentioned only particular conditions of Kusta. They have mentioned specifically where the lesion is present. Like in Vaipadika, Pani Pada Sputanam. So it is present in the Pani. So that is in the hands and in the Pada. So like that it is mentioned. Most of the Kustas, it has not been mentioned where exactly it is located. So we can take it as Sthanika, that is localized, or generalized. Both these conditions we can take. So Kandu Madbihi Saragaisha. Kandu and Raga, itching and redness are the important manifestations of Asaka. And then we can go to another condition called as Tadru. Again, differential condition. I am not concluding here. Sakandu Raga Pidaka. So it is resembling again. Sakandu, itching, Raga, red, and Pidaka. The papules or some eruptions are there in and around. So that can be considered here. So generally, since Dadru will be compared to tinea or ringworm manifestations, ringworm manifestations are very specific to particular regions and it will be in the form of a ring. We will exclude this from the diagnosis. But for differential diagnosis, we will consider Dadru or Dadru Mandala, and then going to another condition called as Kachu, which has been explained in the Kshudra Kusta. All these things are Kshudra Kustas only. Kachu is a condition which has been mentioned. Sakandu Ragapidakam, that is Dadru Mandala. In Kachu, Saivaspotehi Tivra Dahaihi Upeta Gneya Panyohu Kachu Rugra Spikoscha. Very specific regions have been mentioned, but also typically this particular condition will have Srava, that is discharges like Pama. We don't know whether there is discharge in the patient in this particular condition. If there is no Srava, so we will try to exclude this, but in differential diagnosis we'll definitely take, because there are spotas, so there are eruptions, Tivra Daha, and there is severe burning sensation. Again, the patient should tell if there is burning sensation here. And Panyoho Kachu Rugra Spikoscha. Pani, it is manifested on a snow discharge. Taken, madam. So understood that. So Pani, it is mainly manifested on the hands and Spikoscha on the butt. So this is another condition. So we'll go to the last condition, which is known as Shataru. This is also Kshudra Kusta. Raktam Shavam. So here Java is not there. So that is blackish or blackish gray color is not there. But the other conditions are there. Raktam, it is reddish. And Sadaharti, there is burning sensation, there is pain. Again, Mona Bhaji kindly let us know if there is burning sensation, if there is pain. Raktam Shavam Sadaharti Shatarhu Syad Bahuvranam. Bahuvranam, many type of ulcers, like we can see, it is like scattered, it is having small. So that is right. Yes, but if and so the pain is there. So pain is there, Bahurana is there. We can also put it into burning sensation is there as Daha, pain. So we can put it into yes, burning sensation and pain both. Okay. So yeah, we were coming to that particular condition. This particular condition has been compared to erythema, which one? The last condition which I mentioned, Shataru, will have Raktam Shavam, redness will be there, slightly blackish discoloration may or may not be mixed up with reddish color. Daha, burning sensation, pain is there, and Sad Bahuranam. It looks like having multiple ulcers. Okay, though it looks even on the palm and down, even on the forehand, though it looks like a single lesion, it looks like an amalgamation, like an accumulation of small ulcers or small vranas. So this condition has been compared to erythema. Shataru has been compared to erythema. And already I said Palmer erythema right at the beginning. And that is Palmer erythema is very closely related to pregnancy. So shall we conclude that it might be Shataru or Mandala Kusta or Dadru? Okay, so between these things, grossly, if we are not scratching our head on this, we will put it under Kusta, Rakta Pradhana Kusta, or Pitta Pradhana Kusta, or Raktagata Kusta, or Uttana and Gambhira Vata Rakta combination. So the treatment will be expel the doshas, number one, and number two, it will be to boost up the immunity. These two things are the main criteria of this particular treatment of this particular condition. First is the expulsion of doshas, seeing the redness and seeing the dosha involvement. Typically there is pain and there is burning sensation, redness. We will put it into the category of Pitta and Rakta, a bridge between Kusta and Vata Rakta. We will straight away select our treatment Virechana. Okay, Virechana will be there. So if there is itching and also the kapha involvement in another part of the body, we can start with Sabdyovamana and then proceed to Krama Virechana. And the Virechana in this condition, because it is a chronic case, one single sitting of Virechana or one single Vamana will not do. As the Kusta principle goes, the treatment should be repeated every now and then, and a window period should be given where we can observe whether the lesions are present or appearing or reappearing or what exactly is happening. So as the time gap between two episodes increase, that also shows that the immunity of the patient is increasing. Along with that, between the two treatments, that is between two Vega Avasthas, whatever treatment we are giving, we will also in the follow-up be giving certain medications, oral medications, which will take care of the symptoms and prevent the relapse. Already we know that the Panchakarma or the Vamana or Virechana, whatever we are carrying on, they themselves are apunarbhava chikitsa, like they prevent the relapses of the condition. And we need to help the system to understand the treatment protocol and also the blueprint of the treatment, get accustomed to that, and gradually start thinking that these lesions doesn't belong to me, and the interval between the two episodes of eruptions, if they're reduced. So that will be really great experience on the part of the patient. So definitely here we should consider it as, since it is 11 years long, plenty of things have been tried. Amapachana or ama should be addressed or not, it becomes a query again. But still, if we are handling it as a fresh case, we'll consider it as that there is a considerable amount of ama. There is no harm in trying the amapachana. And after doing the amapachana, we shall go with the snehapana. And then, since it is also present at multiple places, I think we can also consider grossly, not by the description as Visarpa. So again, Visarpa, Kusta, whatever it is there, Virechana will be the main spirit of the treatment. I don't mind even if after totally, if the condition comes down, and would you please suggest what herbs to be used for Amapachana? Rather than herbs, I would mention formulations can be used. So since this is, because even very Tikshna medicines cannot be used, we need to see on a trial and error basis how it works out with you, because what exactly you have done over these 11 years. So that will be very, very important for us to understand before administering the treatment. So here only we are discussing so we'll not discuss step by step what to give and how much, what is the dose to give and all those things. These are only the principles which we will be attending, so that it will be an interesting discussion here. So, and then, yes. So that is very important, Dr. Hebbal has typed that. Because of Crohn's, I was about to come to that. You also need to see, because it is an inflammatory bowel disease, we need to see Crohn's and ulcerative colitis or the inflammatory bowel disease. Again, they have an autoimmune component. We need to be very careful before doing that. So in which form Amapachana should be given, that also should be, whether it should be in the form of Deepana Grutas, like Vipali Gruta, that also should be watched, and how much the system tolerates the Gruta. So all those things, small initial exercises should be done before taking up this particular case. So it has a lot of components attached to it. So that is why a deep addressing of this particular problem is needed. So then we will go with a Snehapana, probably with a Tikta Gruta or some Gruta which is available in the context of our Kusta and Vatarakta Prakara Prakarana, and then go with a Kama Virechana. So I think that should be the treatment. And even in after seeing the response of the treatment, the dietetic protocol and also the oral medications which needs to be used later in the context shall be planned accordingly. And very importantly, the availability of the Shodhana Chikitsa in your place, an ideal doctor who can take up the case and study it in detail. So I think mainly this is an interesting case which has been represented here. Palmar erythema. So I remember as reading as having some connection with the pregnancy. Okay, so ultimately, if that can be compared to Shataru, yes, possible diagnosis we have come to, and there are many other conditions which need to be seen through. I may be right, I may be wrong. So this is the way of just discussing that particular case, breaking it into pieces, and then seeing. Of course, after Virechana, we will definitely go with the course of Rasayana, Interim Rasayana in between. So Rasayanas will work as preventive and also will halt the process of the disease. And number 3, enhance the immunity, and recurrences will reduce. Like, we can't assure that recurrences will not take place. Again, a very stringent following of dietetic protocol and also the lifestyle protocol. Everything is mandatory, everything is needed in this particular context. It needs to be addressed as if a cloth. So we give an example in like a proverb. So like a cloth which has fallen on the thorn. So it needs to be trickily. We should not damage the cloth. At the same time, we need to trickily remove the cloth from the thorn. So such is a condition. It is it's not a scary statement here. So it is a statement of cautious. Be cautious while handling this, and a lot of things needs to be seen and addressed. So cases are not to be discussed in detail on the discussion platform like GURUBODHA. Only we can discuss the concepts. The treatment protocol will definitely be handled by a doctor who is very close to you, near and dear to you, and who can take care of. So because there is a stress, why I mentioned the word near and dear, because there is a stress component also. A Dhara also will help the patient in this particular context. A Dhara or the Murdi Taila will also help, because in Crohn's disease and ulcerative colitis, I have seen that the Murdi Taila, especially the Shirodhara and Shirovastis, have worked wonders. And I don't mind at the end of everything, when the lesions become 0 and 6 months down, 8 months down, the symptoms are not there. So we can go with some vastis also, some vastis which are very helpful in Kusta. Okay, so that may not be the treatment of choice right at the beginning. That may not be right at the end also, but still we can consider if need be. So this is a small analysis of this particular problem.
There's a question on prednisone. Before we come to that, Raghuram sir, in case of autoimmunity of any sort, especially when say Rakta and in this case Agni and Kosta, I mean the gut is involved and Pitta dosha is of course involved. A standard Vamana and Virechana would come into picture in case of autoimmunity with these factors involved automatically.
You mean Dr. Heber, this case or in general?
In general.
In general, absolutely yes. Vamana and Virechana say sarve pirogaha mande agno. So very clearly, Acharya Vagbata mentions most of the diseases are, unless proved otherwise, most of the systemic diseases have their direct relationship with Manda Agni or the Agni disturbances. So here correcting the Agni, as you rightly mentioned, is very important, looking through the Kosta and deciding whether Shodhana is needed or not, if needed, whether it is Vamana or Virechana or both. Like in conditions of psoriasis, what I have seen, most often than not, Ubhayataha Shodhana will be very important. Even in eczema cases, Vicharchika cases, Ubhayataha Shodhana is very important. Rather than going with a Vamana or Virechana, Vamana followed by Virechana is very important there. They will give outstanding results. No doubt Vamana will give good results. Virechana also will give good results, but try Vamana and then go with the Krama Vamana and Krama Virechana. They will give outstanding results in psoriasis. Likewise, to build up the immunity, we need to have different choices. Before jumping into the Rasayana, Shodhana is mandatory. After Shodhana, we will come to the Rasayana. But when we are taking through the Shodhana, when we take autoimmune disorders like rheumatoid arthritis, for example, if you can compare it to Amavata very closely, there, rather than a Vamana or a Virechana, Vasti is the best treatment which will take care of the immune process, whatever autoimmune changes is. So what is autoimmunity that we need to understand? So the immunity, our protective system is attacking us. System which needs to protect us, need to help us, need to save us, is misidentifying the body's elements as enemies, body's components as enemies. So the helpers are attacking. In simple terms, somebody is having a pet dog. So you are very much close to that pet dog. The dog is also very close to you. So it is sitting with you, it is sleeping on your lap, it is going with you to a walk. Everything, you are taking care of its nourishment, you are giving good food to that dog, it has become a family member and all those things. But one fine day when you open the door, you don't expect the same dog to jump and bite you. We will not be expecting that. That comes suddenly. So you open the door, your pet dog jumps over you, something has gone wrong and it bites you very badly. So this exactly is happening inside the system. The tissues, the body's own components which are taking care of you, suddenly attack your system. It's not sudden. We think it is sudden, but something has happened in the process where it is attacking. So autoimmune process, the auto-destruction, the self-destruction of the body components by its own components, the body itself becomes its own enemy. In such conditions, time and again we have seen that the Panchakarma measures followed by Rasayana Chikitsa works outstanding. In general, as you have mentioned, this is ideal. And when we come to, the choices will differ definitely when we come to conditions like Amavata, their Vasti or Vasti, what you can call it as the enema treatments, medicated enemas will be the best autoimmune medicines for the therapies for the autoimmune disorder there. So in comparison to a Vamana or Virechana when we give to some gastrointestinal disorder or some other disorder.
If Vata and joints are involved with autoimmunity even.
And there also we can see that Virechana also forms an important mainstay treatment in most of the skeletal disorders and also the soft tissue disorders, joint disorders. A course of Virechana. So just like I mentioned, Vamana and then Virechana in psoriasis or eczema. In rheumatoid arthritis and other conditions, go with the Virechana and then followed by Vasti. So that will give more outstanding. And again, the doctor should be very judicious to see if Virechana is needed at all in that particular condition. Virechana followed by Vasti. So that is left out to the yukti of the physician, how he or she analyzes a given condition.
And I would like to touch base upon this Mahatiktaka Gruta. It is almost kind of a universal herbal ghee, and in this case especially associated with Crohn's disease and plus autoimmunity and vascular involvement, some sort of like headache, repeated inflammation, swelling was also mentioned in this one.
Absolutely.
And I mean post pregnancy care. again, Rakta Dushti involvement and all, and also considering Crohn's disease, we cannot go for like hardcore Sachurna or even our Chitrakadivati, etc., because there could be bleeding tendency
Absolutely.
associated with Crohn's
Absolutely.
disease. So usually, what Gururaja sir explains, Sadipana is often recommended. So
Absolutely.
either we had to go with Tikta Churnas or Tikta Grutas. And the wonderful thing about this Mahatikta ingredients, it contains Saptaparna. Saptaparna is often we use with like Jwara or fever, and in autoimmunity there is often component of fever. Muksa is there to improve Agni, though not very hot or Ushna. There are many things like Pata, Muksa, Ushira, which address the Rasa and Rakta component. Again, Triphala is there.
Nimba
Neem,
and Patola. Nimba and
yeah,
Patola.
Nimba and Patola. Yeah, neem is also there. Turmeric to turmeric and tree turmeric, Haridra and Daru Haridra to address allergic components of the skin, and it also contains Guduchi, which is again used very frequently in autoimmunity. Shrimadu is also related with immunity again. Sariva, and I also saw somewhere even the it also contains Pipali and Gajapipali. In the though it contains Pipali and Gajapipali, it's only 6 grams as with other ingredients, and in a Grita mode along with other bitter herbs which would balance out any sort of pitta aggravation, because Grita is pittahara and almost all bitter herbs are pittahara. This pipali in a gentle low form can give that essential deepana pachana effect without disturbing much of the this one. That's why Acharya Charaka straight away mentions Mahatiktaka Grita in case of this one. Okay, and coming to the and last point before we take up the question, in terms of like medicine for Virechana, especially in Kusta, the deciding factor is that whether we should go for Snigdha Virechana versus Ruksha Virechana. And Sigma Virechana when there is Vata and Pitta are involved, and Ruksha Virechana is usually when Kapha dosha is dominant. And based on this, we can make the decision on Virechana. And of course, there are like skin disease specific ones, but this guideline can be used in general.
Absolutely, yes. We can use this again. Choice of the medicine again depends on the doctor. The dosa identification is very important. The right point you have made, Vata and Pitta identification or Kapha identification, whether there is Ama, Nirama condition of those doshas, very important. Snigdha Virechana or Ruksha Virechana, see there is universal principle. Either people go with the Trivrut Leha or with some Triphala formulation like a Triphala Churna and other things. Erandataila at the end of, because in Snehapana we should remember that we have already given Gruta or Yamakra for oral consumption. Very few people use the Snigdha Virechana even in Vata disorders, because after Snehapana once again we have given Svedana, but again going with Snigdha Virechana, so people are reluctant with. So there are also many cases I've seen of intolerance when Snigdha Virechana is given. So probably many doctors, what I've seen is preferring Ruksha Virechana, so in the form of a Churna or a Avaleha, so that will be the preferred format. And for Virechanopaga, so like if Virechana is not happening, again the decoction of Triphala and other things will be given to stimulate the medicine and also to throw out the doshas. So that is generally handled in the hospitals and also in the clinical practice. Shita Pitta and Udarda, definitely we should be considering about this, though it is not looking like those rashes, but it is due to something which is happening inside. Shita Pitta and Udarda, when we see they have their contribution is something which is happening inside. Okay, so there also the immunity is playing a lesser way. That is why in Shita Pitta and Udarda cases, the conditions repeat themselves. And we should see in Madhava Nidana, Shita Pitta, Udarda Kota are explained after Kusta. Immediately after the Kusta chapter, they have been explained. And the reason the Acharya also gives why, because of the Tvak Dushti. They're having the nature of Tvak Dushti, that is contaminating the skin, and also having the Tridosha relationship and very close relationship with the Kusta. And we are going through some treatment procedures in Shita Pitta, Udarda and Kota. Many Acharyas have explained, especially in Chakradatta and Yogaratnakara, when you see the treatment principles of Kusta, Visarpa, Vispota, all these things have been mentioned in the treatment of this particular condition, Shita Pitta, Udarda and Kota. So we can consider not for the differential diagnosis, but also for the treatment perspective, because the skin manifestation here, though it is not appearing like Shita Pitta or Udarda or Kota, which we will discuss sometime later, the manifestation of this skin problem is due to something which is happening from within. So we can also consider the formulations. If it is not working out from Kushta and Vatarakta Prakarana, we can also try to peep into the chapters of Shita, Pitta, Udarda and Pota and try to consider, because these are the related chapters.
Actually, I have these two questions, sir. One is about, you were describing that this has to be treated. You gave the analogy of cloth over thorns. So does it mean that the patient have to be under the direct care of the physician as an inpatient, or can it be through telemedicine?
Absolutely, Vasantaji. So I always recommend under the observation of doctor, Pratyaksha, direct under vision and supervision. I think that is the best way chronic conditions can be dealt with, not online prescriptions or email prescriptions. They will definitely work. Email prescriptions, online consultations, definitely. We also do that. So because they may give some temporary relief, some symptomatic relief, some definitely if the patient is lucky enough, they can give a big range of relief in symptoms also, no doubt about that. But having said that, always the role of physicians, direct contact with the patient in the Chikitsa Chatushpada, the four limbs of the treatment, is very, very mandatory. Hospital management, there is nothing secondary to hospital management because everything will be taken care of. So the patient can just be a little overcautious or underconscious while taking these medications. Okay, nothing will happen. The doctor has prescribed to take warm water throughout the day. Okay, nothing will happen. So the patient is fed up of taking the warm water. Suddenly the patient pops up some cold water or take some food which has been contraindicated. Okay, let me take once, what will happen? That will not happen when the patient is under the supervision, because treatment is not about the medicines, the therapies and other things. It is about also the discipline. I don't tell the patients are indisciplined, but in the hospital, a constant monitoring will be there, and the patient will definitely not get into the hands which are contraindicated. The dietetic protocol will be planned by the hospital and also the doctor. The same things will be given to the patient, and utmost care will be taken. So that is what I meant by the cloth and thorn analogy. Extreme caution should be taken because the patient has already suffered for 11-12 years. Why take risk? So be under the supervision, make an appropriate diagnosis, very close diagnosis, and let the medicines be chosen in a very appropriate way, and the patient find relief. That is what the patient or the doctor are looking at. Swasthasya swasthya rakshanam, aturasya vikara prashamanam. Managing and maintaining the health of the healthy individual and comprehensive cure of an ailing person. So that is the vision of Ayurveda, and I think I definitely advocate. So as a physician and a responsible physician, definitely I advocate that treatment shall be taken under supervision. So because these cases should be handled in a delicate way, we don't know how much interior is affecting the exterior of the body. We need to respect the system and handle it accordingly.
The second question I have, how does Virechana, which is to the intestines, help joint, which is anatomically far away from there?
Joints, when you are mentioning, it is not like you give a Virechana, like a Triphala Churna also can work like a Laghu Virechana or a small Virechana. It's not like you take Triphala Churna and start feeling relaxed with your arthritis. It's not like that. See, even the joint, when we speak about joint, they are mentioned as Marma Asti Sandhigata. So there are three pathways of disease manifestation. One is Kusta, so that is Abhyantara Roga Marga, they tell, the interior. So mouth to gut, the end of the gut is considered as the Abhyantara Roga Marga. So that is the Kusta, so the digestive system. The second pathway of the disease is the tissues, Dhatu, Shaka. And the third important pathway is also belongs to the tissues itself. Some tissues are subtracted from the 7 tissues and taken into the Marma category. That is the vital spots or the vital organs. They are the Marma, the vital spots of the body. Asti, bones, and Sandhi, the joints and the soft tissues, they fall under the Marmasti Sandhigata. We call this as the mid pathway of the diseases or the Madhyama Roga Marga, we call them as. Now, coming to the joints, it is not the wear and tear. So if the person falls down and if there is an injury to the knee joint, and if you give Virechana, that will definitely not work. In Amavata, in conditions like Amavata, there is a knee pain and the knee swelling because of the interior damage, not because the patient has fallen down. Because it is the damage which is caused by the interior changes, formation of ama, circulating ama settling in the joints, trying to damage the soft tissues therein, causing the swelling, involving vata, pitta and kapha. So many things are coming and assembling into that particular susceptible area, we call it as. Each and every person will have a susceptible area. For me, the head may be a susceptible area. when I suffer from headache very frequently. For somebody, the stomach is a susceptible area because the person's whatever problem it will start from stomach. For some people, whatever problem will start from the cough muscle. So we have susceptible, that is the weaker areas. The doshas and the ama and other principles will tend to, they are searching for a weak spot. Whenever there is a weak spot, etra sangahaka vaigunyat vyadhistatropajayate, wherever there is a weak spot, the doshas accumulate there and cause the problems. I cannot give a Virechana, I cannot put a Virechana medicine over the joint and bandage. Obviously, the healing should be from within. In such conditions, the Virechana or the Basti or the Vamana, these things will operate right from the root. What is the root here? Right from where the ama is formed, right from where the pathological Vata, Pitta and Kapha are formed. Right from that particular root it plays. And look at Virechana. Before giving Virechana, we have given Snehapana, we have given Abhyanga, we have given Svedana, so many things, Deepana, Pachana, so many things have happened. We are trying to meddle with those doshas and ama, and we are trying to constantly hit them. And with Virechana or Vamana, we are trying to expel them out of the system, telling boss, your job is done, you are out of the system, you are not going to the joints, you are not going to the bones, you are not going to the soft tissues and harm them. No. We are expelling you. We are not trying to subside you. We are expelling you from the system. So the question is very interesting. The joint is very distant from the place of Virechana, but the origin of the problem in the joint is from the place of Virechana. I think you are getting it. Whether it is a stomach or a gut, that is the place of origin. So Virechana and Vamana are given to those conditions of the joints and the soft tissues or bones, whatever it is there. When those diseases have their origin from the gut. I think I'm clear.
Here, sometimes Trifla doesn't work and it causes dryness in Vata condition. Yeah, Trifla is basics first. Trifla is specifically addressed or advised in Kapha and Pitta disorders. As you can see here, Trifla Kapha Pitta Agni. So not commonly advised in say Vata condition unless for rejuvenation or anything. So the dryness component is well undertaken, and being astringent dominant, there will be surely that.
Think of Vata, think of Snigdha Virechana. So like the castor oil preparations, even in the last class we were discussing, they'll be the best. We can go with the Snigdha Virechana itself.
Yeah, that's pretty standard. And I mean, castor oil is told that like how a lion controls an elephant.
Intoxicated elephant.
Yeah, that's how castor controls Vata. So can we discuss diet protocol? Probably bitter inclusion of some bitter herbs and Pitta and Rakta balancing herbs in this case will be helpful.
Absolutely.
And there's a question on so why there is one particular weaker area for a person. This is just another question because because we are all born with Prakriti, with Vata, Pitta, Kapha dosha, naturally dominant in them. One or the other weaknesses are bound to have, unless we are like Tridosha Prakriti person, where Vata, Pitta, and Kapha doshas are all balanced. After taking castor oil, we experience constipation the next day. This castor oil is not given as is. Just as a standalone medicine for Virechana. Somebody has to be done Virechana, we just give castor oil. It's not like that. We do the Snehana, Svedana, Snehana, Abhyanga and Svedana, and only then it is given.
Yeah, coming to this question, castor oil can also be independently given if you're giving Sadhya Virechana. So and also Nitya Virechana. So where in small doses in some conditions, we want Virechana to happen on a daily basis. We give castor oil preparations like Gandharva Hastadi Eranda Taila, or Nimbamrutadi, Eranda Taila. These things we give on a regular basis, not on all conditions. Again, the choice of the patient and choice of the condition is very important. And castor oil, when it is given in a correct dosage and after analysis of the problem, it doesn't cause constipation unless it is given in a low dose, or if there is high vata, or if there is ama, which cannot be expelled, because ama and castor oil are having similar properties, it cannot be expelled. So if it is given in a low dosage and if it has not gone out, it will create trouble at some point. Definitely it is going to cause one or two bowels. So the best way of handling this particular problem is try to increase the dose and try to analyze if you have vata predominance or ama predominance. And if you have taken in sufficient quantity and still you are not comfortable that it has eased out of your system, try taking sips of hot water. That will help. So that will help in pushing out the castor oil along with some feces and other waste out of your system. Maybe one or two extra bowels you will have, and that will clear the system. So when properly given in proper dose and after proper analysis, there is no way that it causes constipation.
And there is a question on Prednisone suppresses immunity. In this case, what's the best herb to balance immunity? Rather than just addressing only one factor, we have to take the whole body and the patient into consideration. For example, what is it? Side effects of prednisone on weight gain, indigestion, sleeping problems, restlessness, stress, mild to mood changes, high blood pressure. So there are water retention in the body and weight gain, etc. So there's no like it's not like we are treating in the modern lines that for one particular symptom we have one particular herb. Whole body has to be considered and a treatment line is to be drawn. Yeah, it is said that castor oil contains ricin, a toxic substance. For everything, even there's a list of herbs which are generally recommended as safe, GRAS. In that, even our black pepper is also not there in that list, if I'm not wrong. If you consider individual chemical, it comes with its own positive side and negative side. We also had long discussion on like licorice and glycyrrhizin and glyceric acid causing increase of blood pressure, etc. We are thinking the herb as a whole and not as this one. So if you consider anything for that matter, let's say pipali. Pipali is not good in like very high pitta condition. And any medicine or any herb, any ingredient. Turmeric might not be suitable for all. Some people even have turmeric allergy also. It's not like, just taking one ingredient and blaming the herb is not the way to go, and we have to take the whole herb or medicine into consideration.
Coming to the castor oil, there are some crude forms and also there are some medicinal forms. So here we speak about samskara. Samskara is processing the medicine with some herbs, and when we process a medicine or an oil, castor oil is a base here. We process like Gandharva Hastadi Erenda Taila. There are quite a lot of herbs with which castor oil is processed. Nimbamrutadi Erenda Taila. Here there are quite a lot of herbs with which castor oil is processed. When we process it is called as samskara. When we give that samskara to the castor oil, its toxicity will be removed and the medicinal property the oil will acquire. So in that case, it will not be dangerous to take the medicine. So it is a question of caution. Yes, the medicines in the form of castor oil available in Ayurveda are medicated and processed, which have undergone samskara. So no harm in taking them. But the right dosage and right selection should be there. That should be done by the doctor. Again, purchased on the counter and taken indiscriminately with whatever dose we decide. That will be really dangerous.
That concludes today's GURUBODHA session. Thank you, everyone. See you in the next section. Namaste.